How did TB and HIV co-infection impact global health? How have tuberculosis and human immunodeficiency virus co-infection affected global health? This is a crucial question, especially as these two diseases often occur together, particularly in certain regions. Tuberculosis, commonly known as TB, and HIV have a complex relationship. When someone is living with HIV, their immune system is weakened. This makes them about 30 times more likely to develop active TB. This connection has made TB the leading cause of death among people living with HIV, even those receiving antiretroviral therapy. In 2023, it was reported that around 161,000 people died from TB related to HIV. This figure represents about 27% of all deaths associated with HIV. The impact of this co-infection is particularly severe in sub-Saharan Africa, where about 80% of cases occur. Here, the overlap of these two epidemics is most intense, contributing to a significant health crisis. Globally, an estimated 1.3 million people live with both TB and HIV, highlighting the scale of this issue. The presence of HIV complicates the diagnosis and treatment of TB. When a person has HIV, the symptoms of TB may not be typical, making it harder to identify. Additionally, the risk of latent TB progressing to active TB is increased. This complexity requires healthcare systems to adopt integrated approaches that address both infections at the same time. The co-epidemic has placed immense pressure on health systems, especially in areas with limited resources. Coordinated interventions are essential. For example, routine HIV testing among TB patients and TB screening for people living with HIV are vital steps. Combined treatment regimens can also improve outcomes for those affected. Global initiatives like the World Health Organization's End TB Strategy and the Stop TB Partnership have played a crucial role in reducing the rates of TB-HIV co-infection. These efforts have helped prevent millions of deaths each year. Despite these advancements, challenges remain. Multidrug-resistant TB is a significant threat, and only about 40% of individuals with drug-resistant TB receive the treatment they need. This situation underscores the ongoing need for effective public health strategies. In summary, TB and HIV co-infection has greatly worsened the global burden of TB. It increases susceptibility to the disease, complicates clinical management, and raises mortality rates, especially in sub-Saharan Africa. Addressing this dual epidemic requires sustained public health efforts focused on prevention, early diagnosis, and effective treatment of both diseases. This is vital to reducing deaths and working toward ending the TB epidemic by the year 2030.